This morning, a way to get free prescription medications. If you're uninsured and living in Texas, listen up.
We can help, from infants to elderly.
Carlos Irula is the pharmacist in charge at St. Vincent de Paul Pharmacy in North Dallas.
But here within the last year or so is when we've seen that exponential growth.
They're the first freestanding charitable pharmacy in Texas, serving the uninsured.
And depending on where you live, we could actually deliver it to your doorstep.
All for free. They opened in 2018, but Carlos says the need during the pandemic has skyrocketed. From 2020 to 2021, the pharmacy recognized a 34% increase in patients and a 63% increase in prescriptions. They just surpassed a major milestone, fulfilling 50,000 prescription medications, a value of nearly $12 million.
It's definitely been a blessing. They have been so wonderful.
Alexa Ayers uses St. Vincent de Paul's pharmacy for her father's meds.
He's going to be 60 at the end of September.
James Ayers takes medication for multiple diagnoses: diabetes, high cholesterol, neuropathy, sleep apnea, and bladder cancer.
I was completely blindsided. I didn't even know where to start, and the first thing that I think about is the fact that my father is essentially dying and I need help. I sent an application, his social security information, his driver's license, and within one day, they already had sent out the medicine.
Here's what it takes to qualify for help from St. Vincent de Paul's Pharmacy. You must be uninsured, a Texas resident, have a valid prescription, and a household income at or below 300% of the federal poverty level.
So that means like a family of four could make about just under $80,000 and still qualify for our services.
Irula says the most common prescription they distribute is insulin. A 90-day supply for someone without insurance can cost $750 out of pocket, which would be out of the question for Alexa, a single mom of three.
My father, there's certain things that he can't go without.
Thanks to St. Vincent de Paul, he doesn't have to. All right, now you may wonder where they get the money to be able to give out free prescription medications. Well, the answer is twofold. First, grants and community donations. And second, pharmaceutical companies. So companies like Merck, Pfizer, they fill in the gaps by donating branded meds to them.